Dr. John Shuk Kwan, Head of Communicable Disease Branch of the CHP, and Dr. Gladys Kwan, Chief Manager of the HA. Now, the doctors will tell us about the HA situation and the latest COVID-19 positive cases. Dr. Kwan, please. Good afternoon. There are 1,542 confirmed patients in hospitals. Among them, 210 are new patients.
最近喺呢兩日係超過咗有200個新增嘅確診病人入院嘅，對比起早幾個星期，每日嘅入院人數係多咗幾十人，呢個情況都令到我哋係有啲擔心。就以今日新增嘅個案為例。
Are people about 60 years of age, and more than 20 patients are children below the age of 3. These two groups are both vulnerable people. Once infected, they have higher chance of severe illnesses or even deaths. The most effective way to prevent this is to get vaccinated. Now, the vaccination eligible age has been adjusted downwards to 6-month-old. Now, our general outpatient clinic under the HA offer vaccinations to children. Now, the vaccination center of the Hong Kong Junior Hospital starting next Monday, that is the 15th of August, will begin offer Sinovac vaccines for children. We will open booking soon. So parents shouldn't hesitate and get their children vaccinated. For adults, if you are not vaccinated, you should do so quickly. The fourth jab has been adjusted downward to 50 years old. If you are eligible, please get vaccinated as soon as possible. Once again, after infection, even if the symptoms are very mild, you should see a doctor promptly, especially for elderly people and those with chronic illnesses. The earlier you get medical assistance, the earlier you can get the oral and viral drugs to stabilize the condition. Now, we have reported one death today. The deceased patient is an 85-year-old senior citizen without a vaccination record. The patient had hypertension and a thyroid issue. The patient was living with the family members and was able to self-care. On the 19th of July, because of coughing, the patient went to our outpatient clinic. After leaving the saliva sample, the patient was confirmed on the 20th. And then through the patient support call, we have reached out to the patient. Twice we have inquired whether the patient had symptoms or if the patient was feeling unwell. There was no fever and there was no symptom. This situation was stable. We advised the patient to self-monitor his health and left the patient with a contact method. Now, on the 28th of July, the patient lost appetite and had shortness of breath. So the patient approached the A&E. There was no fever, but the patient required oxygen support and was then transferred to the medicine ward. The situation deteriorated quickly, and the patient was transferred to ICU. We had prescribed the patient with the antiviral drugs as well as steroids. However, the situation of the patient's lungs deteriorated quickly, so the patients passed away yesterday. 182 patients have recovered yesterday, including 165 patients discharged. And also 5 patients have been found positive via screening. 8 ward patients and staff were classified as close contacts. We have 80 2 more HA staff infected, and 26 more have returned to their positions. Dr. Zhuang, please. Good afternoon. Yesterday, the total number of positive cases was 4,180, including 1,289 PCR positive and 2,891 RAT positive and then confirmed by PCR. We have 196 imported cases, including 180 PCR positives and 16 RAT positive. Now, like Dr. Guan said, we have one death today. The total number of deaths in the fifth wave is 9,342. It includes 3,872 female deaths and 5,470 male deceased patients. The total mortality rate is 0.68%, same as before. Now, there is a great difference between vaccinated and unvaccinated patients. With 3 doses, the mortality rate is 0.04%. For totally unvaccinated patients, the death rate is 2.88%. That is a 70 times difference. Now, we have more deaths from people aged above 80. We have 6,600 cases. Now, for the people above 80, the vaccinated and unvaccinated death rate with 3 doses, it is 1.03%. Still higher than other age group, but lower than that of the patients who have received 2 doses. The mortality rate for people aged 80 with 2 doses is 3.58%, 3 times higher. With just one jab, the death rate is 6.77%, 7 times higher than those with 3 doses. For those with 0 dose, the death rate is 16.12%, 15 times higher than those with 3 doses. So if you have not been vaccinated, especially for elderly people, you should get vaccinated promptly. No matter how many doses, with 1 dose, it would be a better protection. Now, for imported cases, we have 196, 68 were caught at the airport. 98 were tested positive within 7 days during the hotel quarantine period, and 30 cases were found after 7 days. They are from 43 places, with 5 places having imported more than 10 cases. For UK, it is 28, India 21, the US 14, Singapore, and Thailand 12. The other 38 places have imported 10 or less cases. For care homes, we have 5 residential care homes for the elderly people and 1 residential care home for disabled people experiencing an outbreak. Now, for Fengyuan RCHE, we have more cases. Yesterday, 5, today 1. Altogether, 35 residents and 3 staff members are under quarantine. Now, Port Oi Hospital at Dai Kwun RCHE, 4 residents infected. 耆康會群芳 RCHE in Shatin, 1 resident infected and 1 quarantine. 真鳳凰 RCHE, 1 staff member confirmed, 13 residents and 3 staff members quarantined. 會期 RCHE, 1 resident infected and 4 residents quarantined. Lutheran Society RCHD, 1 resident infected, 6 residents quarantined. Now, today is Thursday for schools. 231 schools have reported 287 cases, including 230 students and 57 teaching staff. The 287 cases are from 68 kindergartens or child care centers, 95 primary schools, and 63 secondary schools, and 5 special schools. In the past 7 days, 121 schools have reported 2 or more cases. So we have advised 3 schools with classes to be suspended for 1 week.
咁就第一間喺
The first one is in Yundong Po Leung Kok 羅氏順學堂 the 53A class. So there are 8 classes in this school. So this is a special school. So they would need to be suspended for 1 week in Kowloon Shing on Long Po Road. There's a school in K2 class with 19 students and 2 confirmed. They need to be suspended for 1 week. And Seng Gong Wui Seng Bei Double in Stanley K2 AM class with 14 students, in which 1 teacher and 1 student was confirmed. And so this class will need to suspend for 1 week. In the past 7 days, BA.4 has seen a number of around 10.7%. BA.2.12.1 is around 7%. But if we look at it by day, it's around 15% is suspected as BA.4 and 0.5, and for BA.2.12.1 we see a slight drop of around 6.5%. It's now Q&A session. Please identify your media organization before you ask your questions. To the left, the gentleman in the back. Good afternoon. I'm from TVB. First, I'd like to ask Ik about the 85-year-old patient. Was that a positive case? And the second question is for Dr. Chuang. There seems to be outbreak in the residential home. So do you know where the source comes from? Is it brought along by the staff who work there? I also like to ask about the amber and the red codes. Are the codes working? We hear from confirmed patients that their code is still blue. So this confirmed patient was confirmed on the 9th and reported it to the platform on the 10th. And then on the 10th, when Leave Home Safe app was updated, the code still remained blue. How many confirmed cases have not yet seen the red code on their Leave Home Safe apps? Would you need to follow up and to ensure that they would receive a red code? On the 85-year-old female, so she had symptoms on the 19th and then was confirmed on July 28th. We do not have any PCR records between those days. Therefore, we do not have the information on whether she is a positive case. However, we would like to bring up the importance that there are many such elderly people in the community. As Dr. Chuang said, they have not yet been vaccinated or they have only had 1 vaccine. Therefore, when they show symptoms, we suggest them to approach us as soon as possible. Even though they may feel well, after a few days, they may see mild symptoms and they may not have a good appetite. And when they start to see fatigue, sometimes these are symptoms. And once the symptoms show, even though they're mild in the beginning, they may aggravate very quickly. Therefore, we really call upon the elderly to get vaccinated as soon as possible, and when they feel unwell, to see a doctor as soon as possible. Children are also of concern. Children of the age of 6 months can now become vaccinated, and we urge parents to bring children to be vaccinated as soon as possible. The residential elderly home has 7 confirmed cases, and we believe there is a slight outbreak in the home. We do not yet know the source yet. At this moment, other than the residents there, we do not see other people being infected. For the red and amber code, those who are confirmed after the 9th will see a red code. I'm not sure about the person you are talking about. If that person report through the RAT platform, he or she should receive a red code after uploading the ID card number. perhaps they can follow up with our colleagues. Next question, please. Good afternoon from Now TV. First of all, I'd like to ask about whether there are any new cases and the outbreak in Hong Kong Children's Hospital. I'd like to ask about the 6-year-old who was infected with measles. Did she infect any other family members? The 6-year-old girl is stable and has been discharged from hospital, and the family members have not been infected. At the Children's Hospital, we have conducted PCR tests for the patients and our staff, and currently we do not see any new cases. Next question, please. Good afternoon from AM 730. How many eligible arrivals can leave hotel quarantine early today? At this moment, are there any arrivals who are tested positive after the 7-day hotel quarantine? For the Feng Yun elderly home, how big is the residential home? Are there only 30 residents in the home? So there are only 3 staff members working there. I also like to ask about measles. We've seen 2 local measles cases within a month. So what are your observations and views on that? There are about 9,800 arrivals who are able to leave hotel quarantine early today. And currently, we do not have a number on confirmed cases after leaving hotel quarantine. For local measles cases, in 2016, we have basically eliminated all measles cases in Hong Kong. But that is only cutting off local transmission. Sometimes there are imported cases or local cases may arise from import cases, and we will try our best to stem the transmission. However, measles is very contagious, and therefore the most important thing is to ensure that they are vaccinated. 95% of the children in Hong Kong are vaccinated against measles. The elderly home has 7 cases, and they all live in one wing of the residential home. The 30 close contacts live in the same wing, and that's not the total number of residents. And some of them need to be isolated and quarantined due to various reasons. And some of the staff members also need to be quarantined because they might not have been wearing PPE. Next question, please. Good afternoon from Ming Pao. Do the 7 patients from the Feng Yun elderly home have strong symptoms? And do you know which strain they are carrying? And for the elderly patient who passed away, did she show any symptoms when she was admitted? And did she receive support from the patient support call? Are there any measures in which the CHP can follow up with infected elderly patients and to arrange for the elderly to be admitted into hospital or move into isolation facilities?
I don't have the information about the 7 infected residents in the care home, but it was back in April when the elderly home had another infected case. Now the first jab and second jab coverage was about 40%, and the third jab coverage for the elderly care home was 17%. Now all the residents are required personal care when taking a bath, going to toilets, or eating, so they require more care, and that may be why the infection was caused. Now, concerning the disease, as the A&E, the PCR results show that there is a CT value of 27.3. Now, we have reached out to the elderly lady twice. She reported no symptoms, and the oral viral drug would usually be prescribed to symptomatic patients. Now, we understand that for quite some time, and initially there may be no symptoms, but we reminded the patients to monitor her health, and we have left a contact number for the patients to call us back. So in terms of follow-up, we would remind the patients to be mindful of the symptoms, and we also advise the family members to pay attention to mild symptoms, for example, loss of appetite and so on. Any other questions? The last question, please. Sorry, the speaker is not coming through the mic. For elderly singletons, that might require the coordination among the CHP and the DH. It depends on whether there is a medical need. If there is, medical treatments may be called for at different institutions, and we will study where we will arrange what arrangements can be made for singletons. Now, concerning the 84-year-old deceased patient, did you prescribe an oral drug to her? Now, for RCHEs, there is infection in one wing. What about the other wing? Is there an infection risk? What about the facilities in the RCHE? Is there risk? Third question, now, infants about 6 months old have been allowed the first jab for 1 week. So what about BioNTech? When will it be used for vaccinating infants as well? Now, we have exhibitions ongoing. Now, what about yellow coat people? Can they go to the exhibitions? Now, concerning the RCHE, we would look at the situation. So far, there is only infection in one wing. We would test all the other residents, a daily RAT, and also the PCR test as well. For the residents under quarantine, they live in the wing experiencing infection. Now, we are working on procuring the BioNTech vaccines for infants. Concerning other policy matters, the government will take a comprehensive consideration. Concerning the death, as I mentioned, at the beginning, the patients presented no symptoms. That's why we did not prescribe her with oral viral drug. On admission, her situation was bad, so we prescribed the intravenous viral drug and as well as steroid to help her. That's the end of the immediate briefing. Thank you.